Overworked, underpaid, and traumatized. Healthcare workers from around the world have borne the worst of the coronavirus pandemic, from the constant threat of infection.
Every day when I go to work, I feel like a sheep going to slaughter.
To the daily onslaught of death.
I cried in the corner. I couldn't take hearing anything more about COVID victims because in the end they were also my victims in a way.
The toll has left many disillusioned and in need of urgent help themselves. Welcome to our COVID-19 special. I'm Monica Jones in Berlin. Thanks for joining us. Risking their lives to help others survive. That's the title of a revealing and quite disturbing survey among healthcare workers who say during this pandemic they face harassment and violence because of their profession. What's wrong with us, with society, to attack those who put their lives at risk to help and care for others? Lots to talk about after this report from Spain.
The atmosphere at the corona ward of Zendal Hospital in Madrid seems almost relaxed right now. Many beds are empty at the moment. For internist Clara Hernández Blanco, the days have again become a bit more bearable. She and her colleagues lived through the worst of the pandemic. It has left them deeply traumatized. I fell into a big hole. I cried in the corner. I couldn't take hearing anything more about COVID victims because in the end they were also my victims in a way. Then last February and March, 400 people would die every day. That was devastating. Many were already desensitized at that point. But of each of these 400, I can give you at least 2 or 3 names and the names of the children. For me, these are not numbers. It also weighed on her that for months she could not see her daughters to avoid possible infections. Hernández Blanco is now in therapy. It helped me to understand that no one outside our field can really understand what we have lived through in here. It wasn't told, and we also don't want to talk about it. Many colleagues in the hospitals in Madrid share that opinion. The experience was too traumatic. First studies show that at least 40% of medical professionals need a psychological assessment. And some experts even think that there's already another pandemic that will soon spread worldwide, the one that affects mental health. In Ceso Arango's hospital, 500 out of 8,500 professionals require extra help. For instance, in the psychiatric ward, which has set up special support groups. We already put preventive groups in motion before it all escalated. These are groups where people can talk about their experience. So you have doctors, nurses, helpers, and one of our psychologists who share what they are worried about. Between the frustration of not knowing how to use their expertise like under normal conditions and not knowing what you deal with, a huge scar has developed, and it's putting a strain on medics. For Laura Sanz, this strain forced her to leave her job. The intensive care medic contracted COVID-19 and then went back to work in the ICU despite suffering from long COVID. We're not superheroes. When you work in the intensive care unit, you're used to 24, 48 or 72-hour shifts almost without a break. Without help, you are strong, you can do that. And all of a sudden you can't anymore. Then it's time to look for help. I went to work crying. Then, at work, I saw how the nurses would cry in the kitchen or where the patients were. The situation was desperate. I found them like this, I cried with them, and then I cried on my way back home in the car. At some point I said to myself, it cannot go on like this. It's a decision she doesn't regret. Many of the affected medics are now processing what they have witnessed. They hope the long queues at Spain's vaccination centers will keep the beds at the ICU free, so they will really have time to heal.
And for more, I'm joined by Christina Hoffman, General Secretary at UNI Global Union, which represent workers in the skills and services sectors, including health. Very good to have you with us. We're not superheroes. That was just mentioned in the report that showed the difficult situation for hospital nurses in Spain. You surveyed 3,000 healthcare workers, mostly working in long-term care like nursing homes. How does their situation compare?
Well, Monica, thanks for having me on your show. Unfortunately, what we found is that the situation for long-term care is similar to that you just heard from these Spanish workers in acute care. Really, so many are subject to low pay, understaffing, stress at work, no PPE, mental health. So, 75% said that low staffing levels hurt their ability to give good care. Half, a majority, said their wages were not high enough so that they could afford just basic things that you need to live, housing and food and transportation. And a third, believe it or not, still don't have access to PPEs. Even worse in some of the hardest hit countries, but fully a third well into this pandemic still don't have PPEs. So mental health crisis across the industry, violence and harassment, and just the crushing burden of caring for people without a break, the demands of time, stress. It's been quite an ordeal for these workers.
Right. And your survey, it was actually looking at 3,000 or even more healthcare workers in 37 countries. Are there regional differences?
Well, across the board, across the countries where we represent workers and in these 37 countries, the problems are all too common everywhere. I think that we could say there's some exceptions for those countries and regions that have strong collective bargaining on a sectoral basis, like, for example, Austria, where there is a way to manage the conditions at work. In those countries, for example, the US, where there is either no bargaining or at best some isolated facilities here and there where workers have the right to bargain. In that situation, that could be the worst. Or where there's just simply no bargaining and no resources in the sector. So I think it ranges a little bit, and we do say some Austria is doing better, or like Austria with sectoral bargaining, but still the problems are pervasive.
Right. I mean, if you just add it up, underpaid, overworked, exposed to disease, and even harassed, do you think there'll be anyone left who wants to take up a career in healthcare in the years to come? And if so, what needs to be done in order to ensure that?
The reality is workers are leaving the care sector in droves. This is a real problem because the more workers leave, the more the burden increases on the existing workers. So you've identified a really good problem because obviously the care, as the demographics change, care sector is going to be a growing part of our economy. We need a strong and well-resourced care sector to get women into the labor force, which is also an engine for economic growth. So absolutely, we need to fix these problems. We need better conditions. We need to address staffing. We need to have PPEs everywhere, just basic protection in or out of a pandemic environment. And this is going to be, this involves more resources. It involves collective bargaining. It involves allowing workers to have an option to have a union, and this is a reality for so many workers of the world. So we think that this has to happen for the future. Otherwise, really, the problems will become worse.
Indeed. Christina Hoffman, General Secretary at Uni Global Union, thank you so much for your time.
Thank you.
Well, one of your questions is also related to the working conditions of healthcare workers. Time to ask Derek.
COVID-19 is transmitted via aerosols, so why do healthcare workers wear all that protective clothing?
Personal protective equipment, or more precisely, shortages of it, has been an ongoing issue for many countries since the start of this pandemic. PPE for healthcare workers includes a wide range of gear, from masks to face shields, to gloves, to gowns. And the point behind all of those products is to provide a barrier between what you want to keep out, which in this case is a respiratory pathogen transmitted primarily via aerosols through the air, and the person wearing the PPE. However, CDC recommendations for people taking care of recovering COVID-19 patients at home don't include ones to wear head-to-foot protective clothing, but only to wear effective masks and at times to put on single-use gloves. Healthcare professionals in hospital wards, however, are regularly exposed to much higher levels of the virus than a caregiver at home. SARS-CoV-2 can't enter the body directly through the skin, which provides a very effective protective barrier, but it can settle on it and remain capable of infecting someone for a while. Experts now believe that for the average person, the chances of infecting yourself by transferring the virus from a surface where it settled to your face via your hands, that chance is actually quite low. But that danger is multiplied for someone who spends their days in a ward full of coughing COVID-19 patients. So donning items like gowns and other protective clothing is an important way to shield yourself if you work with those people on a daily basis.